Thank you everyone for coming. This is, as you know, Alice Hyde's first Daisy Award. So we're super excited to be finally awarding it. And for those of you who don't know, the Daisy Foundation was established in 1999 by members of the family of Patrick Barnes. And he died from a disease attacking the immune system, so that's what DAISY stands for, disease attacking the immune system. And as they brainstormed, his family, what the Daisy Foundation would actually do after they made it in his memory, they kept coming back to the one positive thing they held on to during his 8-week illness, and that was the extraordinary care that he had. So the family was impressed by the clinical care that the nurses provided, and what really overwhelmed them was the compassion and kindness that his nurses brought. So they created the Daisy Foundation and the Daisy Award for Extraordinary Nurses. This started out as a thank you for their family to nurses, and it's grown into a meaningful recognition program embraced by thousands of healthcare organizations around the world. And we're super happy to be presenting our very first one today at Alice Hyde Medical Center. And it's a big secret, and we were overwhelmed by the number of nominations we had. We had 28 nominations, and they came from families, they came from patients, and a lot of them came through patients, so that was really nice to see. So it was really difficult for us to pick because we had to go through all 28 nominations and figure out. I said to the committee, which one gives you the biggest goosebumps, and that's essentially how we made our decision. So we're very pleased to be honoring Cody Brown today. So, congratulations. I just want to share a little bit. This came from your nomination was not only a peer, but also a member of a family member that you were taking care of. So, being admitted to the hospital can create anxiety for any patient, regardless of their age. For the youngest patients and their families, however, a trip to the emergency room or an overnight stay on an inpatient unit comes with added complexity, especially when the patient is so young that they often struggle to communicate with their loved ones and caregivers. Keeping a young patient calm and providing compassionate care to both the child and her family is what prompted Kara Leonard to nominate registered nurse Cody Brown for Alice Hyde's first ever Daisy Award. Do you remember this patient? Yeah. Alice Hyde's emergency department is where Kara and her 2-year-old daughter Piper found themselves on the night of Valentine's Day in 2022. Piper's a spunky child, had just recovered from COVID, and they were unable to find a spot for her pediatric placement in the network because it was so jam-packed. So the baby, Piper, was admitted to our IMCU. She says, Kara, it was just a stressful situation. Kara was also pregnant with her second child at the time. And so she went on to say, it was comforting to be here and around people that we knew and who had taken care of Piper as an infant, because Piper had spent some time here in the emergency room and in the nursery after she was born. She had some breathing problems. The next morning, with no available beds in dedicated pediatric care facilities, Piper was admitted to Alice Hyde's immediate care unit where she first met Cody Brown. As Piper's treatment continued, she required multiple IVs in addition to oxygen, and would remain in Alice Hyde's IMCU for 4 days. Kara said Cody quickly emerged as someone who could bring a smile to her daughter's face. He was just very good with her, said Kara. Cody took the time to interact and talk with her, and it was amazing to see how they connected. I think it's hard for people to understand how big a job it is to keep a young child calm and entertained in that situation. When they're 2, they don't want to sit still with an oxygen meter on one foot and an IV in the other hand. By Piper's 3rd day in the IMCU, Kara said Cody had created a balloon for her to play with using a surgical glove and continued to find ways to keep the restless 2-year-old, who would eventually be discharged the following day, calm and comfortable. My husband Mike and I both know Cody and we trust him. Seeing him walk through the door of Piper's room that first day made us feel so much better, even during what was a really, really anxious time for our family. So again, congratulations.